story now. Tomorrow, the 8th of March, is International Women's Day. This year, the United Nations theme is Women in Leadership, Achieving an Equal Future in a COVID-19 World. Women must be allowed to play a role in pivotal decisions being made right now as countries respond to and recover from the COVID-19 pandemic. So ahead of this important day, to help us reflect on the challenges women face around the world, we're joined by Dr. Tlaleng Mofokeng, the United Nations Human Rights Council Special Rapporteur on Right to Health. Dr. Tlaleng, thanks a lot for joining us this evening. I mean, we look at this theme, which looks at encouraging women in leadership in achieving an equal future in a COVID world. But the realities are that across the world, women remain concentrated in lowest paying jobs. So the question is, how far off is that equal future, or has the pandemic managed to narrow that distance?
Oh, absolutely not. The pandemic has actually compounded a situation that was already dire. We know in terms of the United Nations and the Sustainable Development Goals, goal number 5 is about gender equality. But we know that gender equality cannot be achieved by only focusing on just issues around women empowerment. There are other systems and other important elements in society that needs to be working at the same time to ensure gender equality, whether it be on a policy level, at a national level, at a district level, but also issues around access to healthcare and quality services.
I mean, let's take a look at matters of governance for a little bit. I mean, gender equality among heads of government, for example, will take another 130 years. This is according to reports. So when we're talking about the need for us to disrupt, what kind of disruption is needed to achieve this equality sooner rather than later?
So firstly, we need to know that women, it's not that they need to be empowered because they are not speaking. Women have spoken many times on many issues that are important to societies, but they remain unheard. If you look at just the issue of gender-based violence and femicide in South Africa, and how many times women have been physically on the streets marching for access to services, for prevention, and for resourcing of these types of facilities post-violence for victims, and yet here we are. So there is something to be said about governments and leaderships that just don't listen. And there is a hierarchy that's replicated in all spheres of society, whether it's in academia, whether it's in the economy, whether it's in political leadership, and in society in general, where women still bear the brunt of inequality and poverty, and many of the obstacles are structural, right? And what COVID has done was really compound and expose those existing structural fault lines, and that haven't been improved, unfortunately, since the pandemic.
Yeah, and if we have to zero in terms of the realities in South Africa, I mean, the unemployment figures would reflect how women, and how especially black women, remain at the bottom of the barrel of opportunity, and in fact, even further exacerbated by COVID-19 pandemic. But then the question is, you speak about policies, Dr. Tlaleng, we speak about needs for government and institutions to actually reform, but is there political will to implement? There's political will to formulate policy, but we know that policy without implementation is nothing, and unfortunately we're accustomed to that in this country.
Absolutely. And all of those policies and all of those plans have to be based on the bedrock of human rights. And most of the times, that's where the disconnect is, right? South Africa, like many other countries, are signatories to many treaties around the world. And yet, when it comes to accountability, when it comes to transparency, when it comes to data collection and resourcing in a sustained manner, these issues don't actually bear fruit. And we know even with COVID-19 and the pandemic, what has happened is, as much as people were told to go under lockdown and be at home and try to be safer, it's women in the services and hospitality industry and the healthcare force of this country who couldn't stay home and be safe during COVID. Many have lost their lives. Many were already in jobs that had poor labor securities and labor protections. The gender pay gap, in fact, is growing in lower income countries. And so we know that to come out of this issue that we have, COVID has really complicated a situation that was already dire. And it's really through resourcing and multilateralism and global solidarity that we can thrive. And also something that we don't speak often about, it's the unethical recruitment, right, of the so-called global north, where they are taking the skill and the brain drain from the global south to enrich and develop their own economies. So there's so much to be said about how to safeguard, but also make sure that human rights are the center of all of our plans, of our resourcing, and definitely to reach the grassroots level.
Yeah, and Dr. Ling, as we wrap up this conversation, we often speak about African solutions for Africa's problems. At this stage, can Africa truly work together, especially when it comes to being able to enforce some of those existing policies around achieving gender equality? Or if we're looking at the state of African countries, it's almost a push-pull effect.
You know, besides the mitigation and the containment of the spread of COVID-19, there is really so much that can be said, even just in the region, about regional cooperation and multilateralism that is vital for facilitating each of our own countries in the region's independence, but also importantly, how we will come out and do the groundwork for a robust but also sustained, inclusive socioeconomic recovery. And I think it's very important to be honest, right, about what hasn't worked and really talk about policies that either perpetuate anti-blackness, right, that are anti-poor, and talk about how to turn those around. And we know that young people have the ideas, young people have the energy and the vigor, and they are the ones who are navigating these very difficult situations on a daily basis. And we don't want to wait for another 30, 40 years before the young people of today can lead and be in positions of leadership. They know what they want, they know what they need, and they know the road that will lead them there.
Dr. Tlhaleng Mofokeng, thanks a lot for joining us this evening. We'll leave it there. United Nations Human Rights Council Special Rapporteur on the Right to Health and Commissioner at the Commission for Gender Equality. That's Dr. Tlhaleng Mofokeng.